Okay, I think we can start. There's 75 of us already. I hope everyone can hear me. Good day, everyone, and thank you so much for attending this launch event. My name is Leila Al-Odad, and I'm the MENA Director at the Women's International League for Peace and Freedom. I'll quickly start with some housekeeping, just in case any of you need interpretation, so you get all the technical support that you need as early as possible. This launch event will take around an hour and a half. It is available in both English and Arabic. You can see an interpretation link on the corner, and please use Chinese for Arabic. أي حدا بيحتاج للترجمة لو سمحتوا روحوا على قسم الترجمة بأسفل الشاشة واستعملوا اللغة الصينية للعربية. للأسف في مشكلة بزوم وعم نضطر نستعمل اللغة الصينية. الجلسة مسجلة وهي so the session is recorded and is available on our social media at the moment and will be available on YouTube after. In order to, Nihat, can you go back, please? In order to listen to the interpretation, if you're on your computer, you can see on the screen now, there's an interpretation button that you can use. Please don't use Arabic, use Chinese if you're referring to Arabic. And as you do that, please press mute original audio so you don't hear the other language being spoken. If you are listening from your mobile, next slide, please. You will have 3 dots on top and you can tap it and choose the language. Also, please choose mute original audio if you're listening to interpretation so you don't get interrupted. This is, can we go back to the first slide, Nihat, please? So, second slide. So this session is recorded and will be available. If anybody has a problem with recording, this is a good time to let me know. There's also the option to have a Q&A, and my colleagues at the technical team will be pulling these together, and we'll have 15 minutes at the end to answer any questions by our panelists. Also, you can have the chat option in case you have any technical questions or if you want to leave any comments. And it is live streamed at the moment on Facebook and also will be available on YouTube after. This is both in Arabic and English. So we hope it reaches as many people as need to hear. And finally, if you would like to tweet, please use these 2 hashtags, Defy Failure and Solidarity Against Crisis. Thank you so much. So moving swiftly, I will, I'm delighted to have the opportunity to share with you the outcome of the consultations we held around the Middle East and North Africa to try and identify the impact of COVID-19 on feminist organizations and the feminist movement in the region. As WILPF does, we have applied a feminist analysis to the findings in order to translate them into principled, practical and meaningful recommendations. My colleague Rula Masri, who led this process, will take you through these findings and the roadmap we are developing in order to address them. We are also delighted to be joined by feminist leaders and activists from the region who will join me to discuss the findings, share their perspective and educate us all on where to go from here. A big welcome to Renda Senura, the Executive Director of the Women's Center for Legal Aid and Counseling in Palestine, Selma Kahale, the Executive Director of Dawlati Syria, and Nada Nashad, the Advocacy Coordinator at the Center for Egyptian Women Legal Assistance in Egypt. This report wouldn't have been possible without the generosity of our partners and the feminist activists around the region who gave us their time and shared their deep analysis despite all the demand on their resources. Such generosity, sharing, and solidarity are the signature of our experience working in the region, and it is the duty of all of us here to create the means for them to be sustained. You will also see in the background a very interesting instant graphics of the webinar, and you will very shortly be able to share the recording with those who couldn't make it. Without further ado, over to our Secretary General, Madeleine Rees, who will take you through the opening remarks. Over to you, Madeleine. Thank you.
Thanks, Leah. What a fantastic group of women joining this seminar. I mean, it's really quite amazing. There's one thing I have to say about COVID is it's enabled us to do that. Can you imagine what it would have taken to get all of us in one place, what with visas and flights and all that nonsense? So at least that. So as we move in, I think it's about the 10th month we're on this sort of webinar scenario. At least we can have the amazing people participating that we need. I want to wind back a little bit because early on in the pandemic, as you probably remember, most of the male leaders decided that we were going to have a war against the pandemic. So embracing the rhetoric of militarism and capitalism was inevitably going to guide WILPF into doing an analysis, which was going to be a little different perhaps than some of the other organizations and certainly the governments. We looked at, using militarism and capitalism, we looked at how we had come to a pandemic which seemed to be the government's unable to address. We looked at gender, we looked at inequalities, and we examined these both as root causes, but also anticipating the potential response that would be based on how people's monolithic thinking of these as being the structures of society would inevitably have an impact. As a result, we made and devised blogs on our website showing the analysis that were looking at everything from the environmental impact to the way in which the disaster capitalism could have an impact, looking at how there would be land grabs, looking at how we should be organizing and showing solidarity. And of course, look at international law, particularly human rights law, as a way that would guide us through this pandemic in a way which would be less harmful. Sadly, in far too many countries, our anticipations were realized. And in the meantime, what was the multilateral system doing? Well, not a lot really. You may recall it should have been the United Nations Security Council that would take the lead in devising ways for there to be a peace and security response to the pandemic. Good for the Secretary General, he immediately called for ceasefires. UN Security Council, not so hot on doing that, did eventually come up with a resolution in June, some 5 months later than perhaps they should have done. Mentions a ceasefire, but then gives the get out of jail free for just about every conflict that's ongoing. And then there's a little throwaway line, thanks girls for doing so well in supporting the economies and holding on to societies when all around you is failing. So not so hot there. In the meantime, what we did was we decided we'd put a little bit of pressure perhaps on the General Assembly to do better. And so we devised a set of principles, which we are now rolling out, which we thought would be fundamental to building a very different structure in response to the pandemic. We gave those to the General Assembly, and they did actually come up with a really quite remarkable resolution, but only in September of this year. So we're going to take credit for some of the things that they put in there, saying based on our principles. I don't think so, but you never know. But essentially, we have that good resolution, we have our principles. And just to say, only 2 countries in the General Assembly voted against that resolution, which calls for universal access to healthcare. It calls for real gender equality, no pushbacks. It calls for the ending of conflict so that we can actually focus on the real crises, such as the environmental degradation, which we're seeing. But that's the rhetoric. And how many countries are actually seized upon the content of either that resolution or what we have been saying as civil society? Very, very few. And so I think when it comes to rhetoric versus reality, the crucible, if you like, is very much in the MENA region, because there has been demonstrated exactly what that impact of militarism and extreme exploitation and capitalism has done to that region, not to mention a little bit of colonialism thrown in. So I'm delighted to have all of you so well versed in and brilliant at understanding the situation to explain it back to us and what the impact of the pandemic has been, and also how we can move in a different direction and build back differently. Thank you so much, and I'm really looking forward to hearing all of you.
Thank you so much, Madeleine, for setting the scene. And this report and the consultations that happened are looking at very swiftly at the impact of all what you have said on the ground, already analyzed, already developed. So over to Rula, who led on this process, to share with us the findings. Thank you, Rula.
Thank you, Leila. Thank you, everyone. Welcome for this to this webinar. I'll be sharing my screen just to walk you through the main key findings, which our esteemed, the great feminists are going to focus more on the how these were materialized in different contexts. So the objective of the report that the impact of COVID on women organizing and on women, on gender justice in the MENA region was to examine exactly what Madeleine said, the root causes, and that have led to many of the pre-existing challenges, but also to kind of understand the disproportionate impact of COVID on women, on agendas, and on organizing of women and feminist organizations in the region. In this presentation, I'm going to to mention how the structural failure have manifested in the different contexts across the MENA countries, why the structural failure it happened, and its impact, a grave impact on the agendas and on the organization in the region. On the structural failure, it's it's a well-known fact that governments failed to respond to the COVID outbreak, and this failure has manifested itself in it being in the absence of effective official responses, whether it was weak, as in the case of Yemen or Iraq, it was random, as in the case of Libya, inadequate or elitist, as in the case of Syria, Palestine, and Iraq as well. Policies of stay at home and stay safe, or wash your hands, and stay, all the social distancing, they simply couldn't work in different contexts across the MENA region, especially in countries that are witnessing active conflicts. On the root causes of this, why this response, the official response has failed, is mainly due to, and that's exactly what the feminist organizations and as part of our partners also have highlighted, is the way the authoritarian regimes have used militarization and the securitization of the virus. The way it has manifested, in fact, is through the arrests, the unjustifiable arrests and the detention of journalists, activists, and the women human rights defenders for sharing information, as in the case of many countries, Yemen, Egypt, Iraq, or Syria. The resort to militarized practices to enforce the stay-at-home policies, such as in Syria, Egypt, or Iraq, the use of the virus to normalize the spread of the military or the militarized actions in the case of Palestine and in Egypt, and leveraging the access to the internet as a weapon of war, as in the case of Yemen. Access, the way the water and water and health benefits and the health services were weaponized, as in the case of Syria, and then the increase of the security control, and this is going to be reflected more through the great feminists that we have today with us in the webinar. Patriarchy as also another fault line that was also exposed by the COVID, and that is of course something that has been there as an oppressive system, or one of the oppressive system, and the way it was kind of magnified through sidelining gender and feminist issues and agendas, as in the case of Egypt, or across different countries. The way the judicial system just came to a halt, where it was because of the lockdown, the processes were all came to stop, and then all the women issues and women survivors of domestic violence, they couldn't have access to any justice, and as such it was compromised, as was put by the feminists by feminists in the region, where despite women priorities and increased protection needs, the judicial system were just put on hold, as in the case of Egypt and the case of Palestine. Capitalism is another layer or another fault line that was highly exposed by COVID, and that's through, and to look at this, we cannot but look at the pre-existing structural fault lines, as in the collapsed healthcare system, the economic disparity, and the feminization of poverty that has also become more acute. Continuity of business was favored over the livelihood and safety of most vulnerable groups. poverty, unemployment, inflation, and currency fluctuation. What's happening in Lebanon as an example is something that is worth highlighting, same as in Egypt, Kurdistan region, Iraq, and in Palestine. The women heads of households, or the women as part of the all vulnerable group, were also at a high risk because of the absence of economic security and basic welfare measures and social protection. These were threatened. They threatened women actually as part of this group because they were first to be subjected to arbitrary dismissal in the service sector, not to mention the fact that they work mostly in the informal economy, which also denies them all the benefits and all the security or the economic security. Colonialism, as we will see with by WILPF, our Palestine-based partner, the way it the COVID was used. And it was actually what they did is to kind of monitor the human rights violations that happened by Israel as an occupying state, but then to the violations as an example of this, and this will be mostly reflected by Randa later on during the webinar, the way they used arrests, raids, night raids, or detention of children, among other practices, to make all the consequences on the Palestinian population, but mostly on women, more acute. The opportunism and the virus politics is also another thing that was captured as part of what, as Layla mentioned, how and why through our partner analysis and the women activists who shared their insights as to how the COVID has impacted their work, and the contextual analysis was that the official responses in countries with ongoing conflict was not in line with the magnitude of the complex pre-existing challenges, whether it be the overpopulation and overcrowdedness of the refugee camps and the IDPs, where it cannot simply, all the lockdown measures and all the stay at home and stay safe measures cannot work. The absence of infrastructures and the human security, or even the systemic targeting of healthcare facilities, as in the case of Syria and Yemen, these couldn't just go unnoticed. The virus was exploited and used for geopolitical and economic purposes, and was used and leveraged as a weapon of war, as we mentioned earlier, in Syria and Al Ain camp, but also in Yemen, as in other areas. The multilateral system, as part, the UN as part of the multilateral system, the way the response was insufficient, inadequate, and at time biased, that will also be reflected further in the discussion that will come afterwards. Just to mention that, for example, in the case of Syria, the humanitarian and aid response to address COVID and to have access to the aid, to have access to other regions, it has to go through the regime, something that just doesn't make any sense. The petitions and the continuous calls from partner and Syrian women rights activists and feminist organizations, they went unnoticed and unanswered or unacknowledged. And then the insufficient follow-up by the UNSG on the call for a global ceasefire, as Madeleine mentioned, but also, as we will see, by Rasha Jarhoum. This is something also that is worth highlighting. How all of this has impacted the work, the agendas, the feminist organizing, and the movements in the MENA region. At the level of the agendas, so many issues have came to the spotlight that needs to be addressed, and needs to be addressed in an intersectional kind of approach from a feminist perspective. These issues have been problematic, and injustices prevailed all through, but then these even surfaced more due to lockdown measure and due to all the failure in the response. Care economy and the economic security of women is one aspect of which the SGBV and the access to SRHR services was also compromised. Like, for example, women in Libya or even in Syria who needed to go to access SRHR services. They needed to travel to neighboring countries to have such access. With the lockdown and travel restriction, this was not the case, which showcased that existing, the existing infrastructures were not ready and were not adequately responded to. The censorship, the silencing, and the active targeting of women human rights defenders is on the rise as the heightened risk of marginalized and disadvantaged group. The case of women migrant domestic workers in Lebanon is something that is worth highlighting. The kafala system that came under the spotlight is another thing that needs to be addressed, as is the case of the LGBTQI community and all the acute challenges and risks they are facing due to this. On the challenges on the women organizing, I would say, or on the feminist groups and feminist organizations, the COVID and all the situation has furthered their challenges. That also, the pre-existing challenges, I would say, donors' priorities has shifted, currency and the whole economic situation is deepening such challenges. There are more increased restrictions on money transfer. Digital security and accessibility issues is not being addressed, and there's this gendered disproportionate impact of stress and anxiety that came with with the need of a collective self-care and well-being for the feminist activists that also needs to be put under the spotlight. The significant shift in the multilateral spaces for advocacy is another challenge, I would say, that needs to be also addressed and needs to see collectively to see how to shift our response and how to adequately support and resource feminist organizations in the region to continue the work they do. I would add to this the fact that the organizations are being pushed to cover the service gap that governments should be doing, and that through there is this all dependency cycle that these organizations are to be on the forefront to fill in these gaps, while their role as having feminist agendas in place to address all of these issues could be compromised as such. Just to conclude, I'm sorry if the presentation took longer than it should, but to conclude that the challenges are obviously deepening with all the sidelining of the feminist and gender-related issues, with further marginalization of marginalized group, and with, as I said, the pushing women organizations to fill in this service gap. The spaces are shrinking, donor funding and priorities are changing or shifting, and the technology online spaces are available. Definitely they are more available, but they are not necessarily accessible because of all the security or online security issues, because of the internet issues, leveraging the internet and the access to the internet as a weapon of war in some countries. That is worth highlighting. The main recommendations that you could have full access to in the report that is available on our website, on WILPF's website, is to address and highlight the root causes of the gender injustices, to strengthen, sustain, and continue to support and resource intersectional feminist agendas and movements, and to amplify women's rights and feminist organizations' voices and agendas through alternative advocacy mediums. It's a responsibility on all of us to make this happen, to keep the movements going and growing. And I'll stop here and leave the word for all the great feminists that are with us here to shed light on all of these and giving contextualized aspects. Thank you so much. Sorry if I took more time, and yeah. Thank you.
Thank you so much, Rula, for presenting the findings. What sobering outcome, and which our partners and feminists in the region have been telling us about for a very long time, that it didn't need to take a pandemic to address these pre-existing issues. I'm going to move quickly to the militarization and securitization of the virus, as governments have been militarizing and securitizing most threats to in general. I would like to move to our panelists, and I'd like to start with a question to Resha Jurhoum, the founder and executive director of Peace Track Initiative. Thank you so much, Resha, for joining us. The report showcased the extensive structural failures in governmental responses, both within their territory and outside to the pandemic. And it manifested in active resort to militarized security and increased securitization. Share with me your experience and observations from Yemen on how this manifested in a country in conflict.
Thank you, Laila, for having me. So in Yemen, the COVID pandemic reached Yemen a little bit later than the entire world. And the women were already leading or alarming and mobilizing to start the response. Of course, the country has been spiraling in conflict for more than 6 years. The infrastructure is not ready. The health sector is not ready. Apart from that, we are going through a devastating conflict. But the women were able to at least issue the call even before the global call was out to stop, to end the war and to go into a peace process, specifically to respond to the COVID and reach a sustainable and permanent ceasefire. The women also supported clinics, limited clinics that exist. They mobilized resources. They trained first responders. They provided with the equipment needed for the response, whether test kits or the masks and protection gear. But this is not enough because women organizations have done this with all their own limited resources, mobilizing funding from women in the diaspora, but they are facing a lot of challenges accessing the humanitarian fund, for example. But also what we noticed is there was a deprioritization of women's rights in general and programs, and there is a shift towards focusing on COVID, which also affected the work of women's groups. Now, in terms of security, what we saw the opposite. We saw the Yemeni parties welcoming the global ceasefire call and our call as women's rights groups, but they did not turn that into action. We saw escalation of the conflict. We saw new fronts opening. We saw more displacement happening. We saw them implement the security, the quarantine measures in the form of security measures more than really quarantine to prevent health issues, but rather to control and add more layers into security aspects. They also, imposed more closures to roads, to areas that were already besieged, where there was some creation of informal roads used by people, for example, in Taiz, which is a sieged area that people tried to have alternative roads and have been using these alternative roads, which were very difficult terrain to move through. They were also closed in the name of COVID response. They detained people in the name of COVID response. They kidnapped people from their homes because they have COVID, quarantined them by force, and did house arrest in areas under Houthi control. I think the response was very security driven rather than really responding to the need. And I will stop here, and I can talk more maybe about our role in the ceasefire later on.
Thank you so much, Resha. There has been a trend in the report and in a lot of the findings that we have seen beyond it about a increased hyper-masculine militarized security response, while an entire failure to acknowledge a human security aspect where everyone feels secure. With that, I'm going to move to Selma Kahali, the founder, the executive director of Dawlati Syria. Selma, I'd like to hear more from you about the Syrian context, and I want to know what's your take on the response from a militarized, patriarchal, authoritarian regime. How has the virus been used as an excuse to impose further restrictions and shifts in the humanitarian aid? And could you also help us shed light on how the virus was weaponized?
Sure, thank you. I think that in many ways this a response to this conflict needed different skills and needed different approaches than you would have to a war. And it was very clear that from the response of governments in the region and around the world, but also particularly in Syria, that these approaches, these tools that they have to control, to suppress, to fight, were inadequate to deal with this pandemic. From the securitization, where in Syria, for instance, one of the first things that the government did was promoting, asking people to inform on each other if they suspected a case of coronavirus, asking, hiding information, creating quarantine centers that were inadequate and unsanitary, and then forcing people to go to them. There was attacks on care workers and civil society, trying to control them. So even when in the past there had allowed some space for civil society or local groups to address the areas in which they were unable to address, we saw that in their COVID response, the Syrian government not only didn't have an adequate response, it actually tried to control, suppress actors that were trying to do awareness raising or support, delivering services to families that were quarantined. They tried to control them and stop them from doing that work, as well as, of course, continuing their threatening, their habit of attacking healthcare workers. So also threatening, monitoring doctors, making sure they do not speak, raising fears amongst workers that amongst these medical workers, that they couldn't even discuss amongst themselves what was happening and how to address it. So inhibiting a response by people who could have at least addressed some of the gaps that the government and the failures of the government. And then of course, the inability of them to, the inability of the regime to address the needs of the most vulnerable, being very, their responses including stopping public transport, so people couldn't get to their, to their jobs, to be able to get a livelihood, having testing at $100, $100 fee for testing, so not making it accessible and available in order to promote a proper response. And then finally, a weaponization, whether it's water, and that includes, so the regime's weaponization included locking down areas that were retaken and considered regime opposition, areas that were retaken by the regime recently, and they were under suspicion. So these areas became some of the first to be quarantined, using quarantine and the pandemic as an excuse to further limit access of these areas to aid, to and other services. And as well, then looking at it more broadly, in terms of their response, there is much to say about the regime, other actors in the area, including Turkey's use of water or denial of water to northeastern Syria during the pandemic, or the inability of the multilateral system to actually address a healthcare crisis in a conflict, given that the government doesn't control different areas, given that they have they don't have the tools to address these areas. So there was many things on top of each other, which led to the government's failure or the overall failure of response in Syria. I can speak more to that later, maybe, or...
Yeah, absolutely, absolutely. Thank you so much, Selma. Spot on. And it's quite heartbreaking to see a country that has the health system being systematically attacked over the past 9 years, having to deal with a pandemic where healthcare workers, hospitals have been, but also when there's a huge amount of people displaced with no access to any services, let alone healthcare service. And I'd like to go beyond active conflict countries and just trying to see if we have lost Nada to connection problems, unfortunately. So we might have to save this question for a little bit later. Yeah, we did, I think. But I will come back to Nada and ask her this question when she manages to go back online, about where she tried to help us understand these challenges in the Egypt context, particularly with access to justice. I'm really enjoying the illustration that is taking place, helping us map this and look further into it. And it's nicely summarizing what we have heard on militarization and securitization of the virus. I think our key messages from what you have said is how regimes have highly securitized, militarized, and intelligence-based practices and responses could be seen as natural extensions of the pre-existing authoritarianism. All of this has been prepared, has been in place. It's a mindset that is expanding, and it is a way to respond to any threat, let alone a global pandemic. It also highlights the need to addressing the root causes of gender injustice with an intersectional feminist approach. The support of women's rights and feminist organizations, peace-building efforts, and the exposure of fault lines and government's lack of accountability. And finally, in countries with ongoing conflict or war like Libya, Syria, Yemen, Lebanon and Iraq, the official response was not in line with the magnitude and complex pre-existing challenges. I'm just checking if we have Nada. I don't know if Nada is with us. Yes, she is. Sorry, Nada, I think we have lost you due to bad connection, but can you hear me? Okay. Okay, maybe then I will.
Hello. Hi, can you hear me? No.
Yes.
Can you hear me?
Yes. Yes. Hi, Nada. Thank you so much for joining us. I think we lost you for a few seconds, but I think I'm going to repeat the question.
Can you hear me?
Can you hear me?
Hi.
Hello?
Yes.
Hi. Oh, excellent. Thank you so much for joining us, Nada. Nada is the advocacy coordinator at the Center for Egyptian Women's Legal Assistance. And you have been doing an amazing amount of work on domestic violence, on violence against women over the years. So I'd like to have your opinions and views on the challenges that you faced during lockdown and during response to the pandemic when it comes to access to the judicial system.
Yes, thank you, Leila, so much for the invitation and for WILPF as well. I'm really sorry, my connection is horrible. I have no idea why it decided to be horrible at this moment, but Allah, this is what we have to deal with. So just in a nutshell, during COVID, we've conducted a study on how COVID-19 affected women's lives, especially from a legal, social, and psychological aspect. The study covered these three main points, and then it covered also the economic violence that is that women faces on every day, but how it was highlighted when it was coupled with repercussions of COVID-19. But specifically to answer your questions, with regards to the legal rights and women's access to justice on March 15th. And starting by March 15th, it was a surprise. You hear me?
We lost you for a few seconds. Can you just try this last bit? So you were telling us.
Do you hear me? Yeah.
We can hear you now. So
Right.
you were telling us at the situation on the 15th of March.
Yeah. Okay, so just to repeat what I was saying, I was talking about the study we conducted as an organization during COVID, and it looked more into the social legal aspects of women and how it affected them economically and how it affected them legally. But for the sake of the question, I'm going to answer from a legal perspective. And the first thing about it, so the lockdown, it started in Egypt on March 15th. That meant that we had curfew for a couple of hours. It was more mental institutions either shut down completely or they were on partial lockdown. One of the government institutions, or the state institutions that were on partial lockdown was, okay, الانترنت زي الزفت يا تيسير. Okay, let me try and I'll.
Shall we maybe try without a camera?
Hello, can you hear me?
No one is hear you. We can hear you now. Do you want to try without a camera?
Yeah, let me try that. Okay, so now is it much better?
It is good now. Let's give it another try.
Yes, so going into the study directly that we conducted, I was saying that the lockdown started in Egypt on March 15th, and then the implications of it was that several state organizations like courts, for instance, they also were on partial lockdown. And by being partial lockdown during COVID, that is only, it does not only affect women accessing their rights, like for example, when it came to divorce status or marriage status, for example, but it affected the basic rights, economic rights as well. So for example, due to the partial lockdown of courts, many cases on alimony, for example, they were postponed, and they were postponed indefinitely because like for 15 days and then they get another postponement. Basically because even judges and even courts didn't know when exactly the courts are going to completely open or be like fully operation 100%. The problem also, how that affected them, it's the fact that verdicts themselves or the legal or judicial system, it takes long time, and usually it takes long time for women or in family issues specifically for women to access their rights. So when it came COVID, with all the economic repercussions and all the social repercussions, what happened was the women were facing the same violence they were facing, but that was coupled with lockdown and curfew, and then they cannot even access basic money or basic alimony. As a grassroots organization, looking to that point or looking to that concept, it affected even more women than usual, because it's not about only alimony. It's about how the daily life women used to, for example, those who are not officially working in an organization or a factory, or those who what we call the undocumented work or unofficial work. Due to COVID, most of them lost their job. Some of them had to be on indefinite vacations, unpaid vacations, for example. So that, and to have this situation for a woman who has a case, for example, asking for alimony or asking for divorce or asking for custody, that put more pressure on women and put more pressure on the judicial system to satisfy or to come up with a solution to such situation. So for example, there was the Ministry of Justice in April, they launched a trial for the electronic judicial system. And that it started officially in the trial started in April, so that was after the lockdown. But the actual operation, the full operation, it was in October, this October, started by 1st of October 2020. So that was after the lockdown itself, after the first wave of the pandemic, which again, given that courts, they were like fully operational, that was in late August or by the beginning of September. So women faced 3 or 4 months in complete unaccess or lack of access to their basic rights when it comes to economy or when it comes to their civil rights as well. And that affected the levels of violence as well, because already women are in unsafe places with their husbands or their family members. It depends on how the setting is. COVID affected violence against women in that sense. We've seen that 59% of our study sample, they were exposed to more psychological violence. We're not even talking about physical violence at that moment. It's psychological violence. While 35% were subjected to physical violence. How the state reacted to that? Unfortunately, since it was a surprise for everyone, it was a surprise for the state itself, and we lack a law that combat violence against women. That perspective of psychological violence were not even taken into consideration. I'll stop here, and I can, in the next questions, I'll elaborate more on that fact and see how it goes. Thank you.
Thank you so much, Nada. And I'm glad the technology helped us at the end. What you're telling us comes, and we look at it jointly with established research showing first that the Egyptian courts are severely overwhelmed and the waiting time has been huge way before COVID. So this is coming on top of that. Also, research shows that women in Egypt and across the region form the vast majority of unregulated informal workforces. And third, that they are the group with least access to savings, to cash, to livelihood, if they don't work. So the gendered impact is absolutely huge, and the numbers you've said are definitely incredibly worrying. I'm very glad that Renda joined us. Renda, can you hear me? I think you're muted.
Yes, I do.
Thank you so much for joining us. Renda Senora,
actually, I couldn't find it. I had to go into Zoom, and then I got the link.
No problem. Also, this is a particularly bad week to have an event because some countries have changed the timing, some countries haven't. So I'm glad we have you now. Renda Senora is the Executive Director of the Women's Center for Legal Aid and Counseling in Palestine. And we have done a lot of work to look together with WILPF and WICLAC and other organizations in Palestine to look at the situation of Palestinian women under occupation. Renda, we have just been touching base on the militarization and securitization of the virus. And I'd love to hear more from you on how this failure was reflected in the Palestinian conflict, and specifically on the work you do with women on combating violence. You're muted, Renda. Sorry, Renda, you're muted.
My apologies for being late, because my understanding is that the session is at 4, and it has been confirmed today that it's at 4, and we changed the clock. That's why I even think I did not expect that I wasn't on time, so my apologies. Of course, I mean, speaking about the impact of the situation with COVID-19 is really dramatic in the Palestinian situation, because we have been under COVID-19 closure and lockdown since the early March. And this has reflected on a state of emergency, which was really publicized all over the Palestinian territory, but later also in Jerusalem by the occupying authority. And the state of emergency was renewed numerous times, resulting in a state where we have seen that the military and specifically the security agencies were taking the lead in all aspects of life and were enhancing the role of control. And even this was combined with factionalism, like the political party namely Fatah was in the lead in addressing, taking over in all the strategic committees and in all the work that has been controlled with the responses to COVID-19. This has eliminated the role of all civil society organizations, but specifically women, who have been relegated back to their traditional roles. This could be heard also in the rhetoric of the official spokesperson of the government, who was like emphasizing the carefree duties or the unpaid care duties of women within the household and the family, in protecting the members of the family, in ensuring that they are locked down, without understanding the power relations between men and women in our society and how that really is imbalanced and disproportionate in how it is impacting women. Of course, this was combined also with the women victims of violence being locked down with their abusers, and who has exacerbated the cases of violence against women in all aspects of life, with no access to justice, with economic hardships. All of that combined together with the control being given, all responses were official. It was the security agencies, the police, everybody in the streets, even in the strategic committees in the neighborhoods, were all controlled by the security agencies. But despite that, cases of violence, as was publicly said by the officials, reported that, the family protection units and the Palestinian civilian police, they claimed that there was less cases of violence, gender-based violence or domestic violence being registered. And that was without taking into consideration or that most of the restrictions of the movement has not provided any space for women to move freely within the Palestinian territory at one, and secondly, because of the strategic committees being and neighborhood committees being from the local communities, and the women were a little bit reluctant to respond to that because they are known in their own communities. I think all of the under the pretext of COVID-19, I think everybody, all public rights and freedoms were constrained and restricted because of the under the justification of the contraction of the pandemic, and therefore it eventually led to less participation of civil society organizations. Having said that, Palestinian organizations continued to provide the humanitarian support, working on human rights issues and addressing the rights of the people at all levels. But this could easily be a little bit constrained with the state of emergency. So it was the control of the official military and civilian ministries or the official duty bearers taking over at the expense of other players. So not to mention how that would even further negatively impact on the meaningful participation of women in different aspects of Palestinian life. This created a situation where women have been relegated back to the protection roles, to taking care of their family, safety at the beginning, the safety of all members of the family was the priority, but then very severe cases of women who have been enduring violence for years had to come up and speak out. And that's why there has been around 112% increase in calls on our lines for the same period in different months prior to the COVID-19. And we have been 5 times needed in our services, with the failure of the structured system to provide the needed protection, because they got also confused. They could not respond easily, and we had to make initiatives in order to encourage the Palestinians. Structurally, they were not ready for such a kind of long-term impact of COVID-19 on the community. The responses were not quickly. Even women's organizations like us had to initiate the need for the protection of victims of violence, especially that they did not want to send them to shelters because they have to make sure of there were no clear procedures how to deal with that. So WILPF interfered, invited all official duty bearers, and they have issued a presidential decree to organize, or a kind of, the cabinet came up with an order or a procedural system in order to organize the protection of women victims of gender-based violence. So it is like many other governments in our region, there has been a failure. Yeah. There was structural failure, there was more militarization and taking over of the military and the security agencies at the expense of all other major players within the Palestinian society, especially women's organizations and women human rights defenders and actors.
Thank you so much, Randa. Yet another example of women organizations going beyond their resources and means and ability to fill gaps by both governments and also societal gaps and community gaps to address violence. And WILPF have been doing a fantastic job on this. And I'm going to move now to the role of the multilateral system in the conflict, feminist peace, and in the response to COVID-19. As Madeleine mentioned at the beginning, we all had our hopes really high when the Secretary General of the UN published a global call for ceasefire in response to the pandemic. However, the Security Council and the way they have responded to it unfortunately failed to impose measures to take that initiative into action. They also failed to hold the actors accountable to to this failure, but also to for the actors who are responsible, who are part of the conflicts, and those who are fueling it and profiteering from it. I want to ask you, Selma, how has the multilateral system failed to adequately respond to the situation in Syria?
I think at different levels, you know, there was this call that needed us to be, and that needed governments to be more than they were, and to do more, and to step out of their normal roles. Whether it's governments or multilateral systems needed to go beyond. And I think they definitely failed to do that. They definitely failed to go beyond their the roles they play, for instance, or their modes of operation. So you had, for instance, whether it's something like the WHO being unwilling or unable to work with non-governmental actors and to deliver aid and testing kits to the north of Syria, which is not controlled by the regime. Whether it was a resolution that happened within the pandemic, during the pandemic, which was a result of work by the regime and its allies to limit humanitarian access in the northeast, in the northwest again, and closing down humanitarian points, and of course the continued shelling of Idlib in Syria, in the northwest, which we needed to get out of. We needed to recognize how big this moment was, and to be bigger, and whether it's the regime, actors in the region, occupying governments in Syria, and the multilateral system failed to be bigger, failed to step up to the moment. And I think And that failure wasn't, it wasn't just to stop the shelling, again, the mode of operation, but also in trying to deal with the effects of the conflict on as you mentioned before, on the healthcare system, the populations that were left vulnerable or are vulnerable because of the conflict. So on many different levels, this happened. And on the response in terms of needing to, just smaller examples, whether it's the lack of response to the concerns of families of detainees by the special envoy, having requested 1 and 2 and 3 meetings from him to know what is happening in terms of measures for release of detainees because of COVID, or to monitor their situation. There was even a lack of stepping up at that level. So I think at many different levels, political, delivery of aid, whether it's UN or the different governments, we have seen them not step up to the moment.
Thank you, Salma. Resha, I would like to move and ask you what you always tell us about what would peace that works look like. And Yemen would have benefited hugely from a global call from the global call for ceasefire had it happened, had it taken place. Why don't you talk us through what would a ceasefire that actually works in Yemen look like today? And what can we do? What can all of us on this call do to act towards it?
Thank you, Leila. So yes, for us, we lost a key moment that we could have mobilized and really achieved a ceasefire agreement. What our aspiration is always to have an inclusive and accountable peace process in Yemen. This is not happening so far. The participation specifically of women has been a tick box exercise by the UN. Even when we moved to the digital or cyber mediation process, it was not enough to include women. The women still are isolated in their Zoom meetings to discuss on their own. They're not giving enough space to share their concerns. We heard from women who participated that they were muted at some point when they were sharing some concerns. So we are still pushing towards a mechanism or a platform to include women in the peace process in a meaningful way. And we have always said that we're not going to wait for an invitation to be in the peace process, but rather claim the space and send women delegations into the peace process. And this was challenging because now with the COVID, the travel issues has become even more restrictive. There is no visas that you can get. There is you can't move. Very recently, there was a peace consultation process that was happening in Switzerland, led by the UN office, and we were not able to send us an independent delegation like we used to do before because of these restrictions. There were other than that is that we decided that the way to influence is to actually try to influence the process of drafting the ceasefire process. And we requested officially that the draft is shared with us. But the UN office again refused on accounts of confidentiality and sensitivity, which in our opinion is ridiculous because there's nothing sensitive or confidential about a peace process that's going to affect us and impact us as Yemeni citizens. And so what we have decided is to obtain this draft in our informal ways. We were able to get the draft. We were able to consult with women groups and develop recommendations. Frankly, the draft was very disappointing. In our opinion, it's not leading to a permanent ceasefire. Rather, it's going to maybe lead to more escalations of fighting. And the aspect of including women in the process, in the draft, was very, very poor. So we're continuing the efforts to support women, to support the ceasefire process through influencing the draft itself. We have decided to publish it as well in order to push for an accountable process, in order to show the Yemeni people what is being drafted and how they can voice to share their ideas and recommendations on how to guide the process better. This is for the peace process. For the humanitarian, or when we talk to the women on the ground about the COVID, about their work and peace building at the ground, women are not able to access the funding that is allocated even for the humanitarian processes. This space is so patriarchal. It is very limited to men-led organizations. There is a huge criteria for women to access that funding. And the limited funding that they get, women-led organizations that used to focus on gender prioritization and gender justice issues, now there is a force by donors to switch that to COVID. And we cannot compromise. We are dealing with protection issues. The Peace Track Initiative is supporting women human rights defenders and women peace builders who were arbitrarily detained, who were tortured, who were raped repeatedly at prison. When they are out and they seek a grant for protection to relocate, we cannot tell them, no, now the fund is going to COVID, you cannot apply for this protection grant. It sounds very insensitive to the needs. When I talked to the women, I told them about the COVID, they said talking about COVID is luxury in Yemen. It's just another something that to add to the list, to the multidimensional insecurities that we are facing. But it's not the major, I mean, there is a lot that is happening, and yes, we need to allocate funding for it, but we should not ignore the other issues that the women are also dealing with. Thank you, Marina.
Absolutely. Thank you so much, Rasha. It's quite disappointing how I only see a series and series of missed opportunity. The global call for ceasefire had every potential to be a truly peaceful international initiative, one that works. And unfortunately, it has been watered down by a Security Council resolution that created exceptions, which basically allowed all conflicts to continue. It is an opportunity to reflect at a dysfunctional multilateral system, at its effect, and how all actors are now expected to step up and make sure that this inclusion happens, make sure that we try to bring together whatever is left from these processes and all the effort and time and resources that has been spent on it over the years. And we will, I know that you push for that every day, and all our partners push for that every day, and we will continue to do so. And I hope this is an opportunity to do more of that. And one of the biggest factors to push against all of these aspects is the continued feminist organizing across the region, despite the pandemic, despite securitization, and despite all these targeted attacks against the movement. The acute gender injustices were further compounded by the impact of patriarchy, militarism, and capitalism, which resulted in sidelining feminist agenda. And as you mentioned, the shift in donor priorities had a toll on feminist spaces, yet feminist spaces continue to struggle and continue to try to achieve the impact that they have come together to achieve. Nada, I wanted to ask you, what are the key issues that need to be addressed now in Egypt from a feminist perspective? And how has the women and feminist organizations and groups and movement, how are they affected by the pandemic and the structural failure to respond to it?
Yeah, thank you, Leila, for the question. So I just want, before answering to that question, I just want to add one more point to the previous discussion, which is regarding the agenda of the multilateral stakeholders or partners, which is, I just want to reiterate on the fact that COVID-19 it's a factor added to the society, to the problems. It's not a problem in itself. So focusing on COVID-19 as a problem, and then forgetting all about what we've been working through or what we've been facing for the past years and the upcoming years, and focusing only on COVID, disregarding all the challenges that already women are facing in normal times, this has to be stopped, honestly. So yeah, just adding to that point. But yeah, so going back to your questions, actually, so far there are several issues that need to be addressed in Egypt, and it was highlighted even more with the latest cases that we've seen as feminist groups or women in Egypt in general. So with the latest, so we've seen during COVID how violence against women skyrocketed somehow. And it's not only, as I said before, it's not only physical, but it's also psychological and economic. So it's different aspects, and that need to be dealt with. The pressing keys now are, first of all, we do need a clear and a strong law on combating violence against women. This has been a demand for the feminist movement for a couple of years now, for many years actually. But with this at this specific time, with COVID, with the latest cases on the Me Too, the Egyptian version of the Me Too cases, with women coming forward and reporting about sexual abuse and rape and harassment and all of this. And a need on a law to combat violence against women, both sexual violence and domestic violence, to be included in that law, not only in the public space, is now, it's a must. It's not something to be put on the side. And also with the reforming of whether the judicial logistics or the judicial procedures of how they are dealing with issues related to women's rights or women's cases. This is also a must right now, to think of how to ease the process and how to shorten the time or the length of cases, especially the cases that affects the everyday life. Something like custody and alimonies, and they are not cases to be put aside. They are something to be dealt with as a priority, because it affects the basic needs or the basic rights of every family and every woman, in a sense. With the lockdown, with the feminist, for the feminist organizations also, with the expected lockdown, honestly, we cannot put any predictions whether or not there will be another lockdown, because we are somehow the community is coexisting with the virus in a very weird way, honestly. But it's but again, it's still something on the table. And from what we've seen during the first lockdown is that we as feminist organizations, the load of women approaching us, the number of women approaching us has escalated in the first lockdown, and it's expected to increase again in the second lockdown. We're trying to learn from the past experiences and from other MENA organizations in the region specifically, on how to approach this. So what we've done is, we were on lockdown ourselves, but we had to operate in another way. So for example, we had to use hotlines, we had to use online platforms. The point that was a problem, or that actually was a main challenge to us as an organization, was lack of shelters for women subjected to violence. And this is also another issue that we need to raise, is that, and we have across Egypt, there are only 8 shelters for women. 8 shelters for 100 million people is not enough, definitely by all. Then the requirements expected from women, the papers expected for a woman who she's escaping violence, escaping her house, still need to be reconsidered, and it cannot be accepted, because simply a woman who's running she will not think of having her ID, for example. She will think of saving her own life. So we need to rethink, whether as organizations or as a state, we need to rethink of how the shelters should be restructured in a sense that would protect women, children, women who are subjected to what we call the sensitive cases, if we can, or the sensitive matters, if we can call sexual violence cases in that matter sensitive. It has to be addressed in a sense of, each case has to be addressed as a case on itself, not as a number in the crowd. And that's why restructuring the shelters should be put on the priority of the feminist organizations as well as on the priority of the states, since the 8 shelters are run by the state as well so far.
Thank you so much, Nada. I'm going to move to Renda. Beyond all the activism you're doing on violence, tell us more about the challenges you're facing in terms of feminist organizing under these circumstances, and how are you addressing them?
Yeah, I really would like to say that it's very challenging because Palestinian women are living under such a prolonged military occupation. On top of that, we have patriarchal structures that are reflecting direction towards there are counter campaigns during COVID-19 and COVID-19. During COVID-19, there has been a huge campaign against the Palestinian women's movement for our efforts towards the passage of the Family Protection Bill, which was pending before the pandemic. And like Nada, I say some of the problems are chronic. They are chronic and not related to COVID-19. And we should look at the deep problems, deep down there, of the lack of political will, on one hand, on the Palestinian Authority, with the absence with the case of internal political divide, and talks about new elections, which are excluding women because our participation are still in the elections are based on the previous laws, and despite the promises that we will be part of the decision-making processes and they will increase our participation up to 30%, this is not happening. And the elections are not taking place. On top of all of that, we have the colonial occupation that is impacting every aspect of the Palestinian life. Palestinian women are facing the COVID-19 and the patriarchal structures and the Israeli occupation policies all together, further exacerbating their sufferings. And that was really very much felt, especially when we were left alone in the forefront to face the more conservative traditional elements in the society who used the pretext of cultural and religious discourse in order to attack us and to consider us as bringing in alien ideas to the Palestinian society. So we have to take that into consideration, that there are many challenges that are very much intertwined and very much connected with each other that are impacting our lives. This also combined with the absence of accountability at the international level, the failure of the international human rights system and the United Nations and Security Council to take measures in order to change the situation for such a prolonged military occupation that has also disproportionately impacted the Palestinian women specifically. So today, for example, the Palestinian women's organizations with the Ministry of Women's Affairs launched the second generation Women, Peace and Security agenda, which we are very proud that we have developed in a comprehensive way, but also in collaboration with the official institutions. It was the work of civil society organizations, the women's movement, with the human rights movement, but the women's movement specifically, with the official duty bearers. But despite that, we are looking at a situation where we are seeing the international community very much reluctant to take steps or measures in order to address the root causes of our sufferings as Palestinian people, our right to self-determination, and on the contrary, the endorsement of annexation by the United States. Only today we've heard about the steps taken by Trump in preparation for the elections, the United States elections, and the control of the powerful countries on the Security Council, which makes us sometimes disappointed that we don't see at the international level that there is the real intention to resolve such a prolonged Israeli military occupation that is impacting negatively all aspects of our lives as Palestinians, and that all what the United Nations and the Security Council is doing, despite the fact that they have to maintain security and ensure the human safety of all the humanity. According, the role of the Security Council is only to manage the conflicts instead of resolving those conflicts. And our case is a very clear case of that situation. With now all the agreements made with some Arab countries, we are losing hope that there is a solution. But the bright side is that the Palestinian civil society is a very vibrant society, and the women's movement is a very active one that is really consolidating efforts in order to build momentum and to take it up from, despite the challenges, in order to address their needs that have been existing before COVID-19, but are still need to be addressed at the national level. And the role that we're playing at the regional level, in the MENA region. We're so proud that the women's movement in our region, in the Arab world, we have been able to activate networks and to exchange experiences and see how we can join efforts. This is very unique. I think maybe the MENA region is so unique in engaging and in trying to build networks and cooperate, because there are a lot of things that are common. All of us suffer from situations of conflict. We're not left alone. We are suffering from occupation, but our region is suffering from conflicts, injustice, inequality, which has been exacerbated further with the COVID-19. The most vulnerable groups are suffering more, and that really creates more the opportunity for working together and making our demands more clearer to the international community, to the official duty bearers, to our governments, that they have to move on the current existing situation which women suffer from within our own patriarchal structures, and the enhancement of the traditional roles, without understanding that real peace cannot be achieved with the exclusion of over 50% of the population, and that women should be part of the decision-making processes, and a just solution to many problems cannot in any way exclude 50% of the population generally. So there are hopes, because we continue to be active, and we can find ways out despite the challenges. And I think a good example is what the Palestinian women are doing, and the Arab women in our region within the civil society organizations movement and the women's movement specifically.
Thank you so much, Randa. Absolutely spot on. We have 6 minutes, and conveniently 3 questions, one to each of our partners and to each of our speakers. So I'm gonna start with a question addressed to Selma, and Hana Abbas would like to ask about the slower response of the international organizations to the pandemic, and the failure to take a fast action to support women and girls in countries with weak government. Could you share your observations on that?
Sure. I think that, part of it is that, women's organizations have been on the front lines, not only of the conflict, but also of the pandemic. Feminists, women's organizations, as well as women in care professions, they really have been at the forefront, first and initially dealing with violence, patriarchy, dealing with with authoritarianism, and now on top of that, dealing with the pandemic with no protection, with little protection, whether it's PPE, whether it's other measures to support these women on the front lines. And then on top of that, you have the added burden they have of caring, whether it's caring for the sick, caring for children who are home, trying to do, so there's been many, many layers added of women on the the front lines, dealing with this pandemic without the right kinds of support, with added pressures, added responsibilities. I think on top of that, and without the international community providing any mechanisms to support these frontline organizations, as was mentioned before, whether it's funding systems or reporting systems, all of these things that have not allowed these frontline groups, organizations to actually be able to do the work that they need to do on the front lines. But I do want to say that I think that there is this pandemic provides some opportunities for feminist organizing. One of them being, I think one is the very clear failure of masculinist leadership and these tools and these approaches in addressing the conflict. And second of all, it is that, at least on a very small level, on the local level, having things become online, in the Syrian context, women have been able to engage, women who have not been previously able to engage in advocacy or networking or sharing have been able to do so much more. There have been new opportunities to hear women's voices that you wouldn't hear otherwise. And so I think part of what the international community, those who are working in solidarity, is how do we support these women on the front lines, hear from them, given that we have shifted to this online, and how we can hear from them, how we can amplify their voices.
Thank you so much, Selma. Spot on. We have 2 more questions in around 2 minutes, so I'm going to ask our speakers to limit the answers, although very, very important. We have a question from Vanessa Farr to all panelists, and it's reflecting on what Nada said about requesting laws on violence against women. Vanessa said that feminist analysis clearly observes how states enrich patriarchy, especially through how law is written and delivered. So how are new violence against women prevention and response laws going to be different or more effective than what we already have?
Maybe I say in one, we can as a feminist movement in Palestine, we are always there looking at it from a perspective that would really address the priorities and needs of women, because we deal with the women victims of gender-based violence and we know what are their needs. Therefore, we go back to the reference point of using international standards to develop our own legislation, but we also look at it from the actual needs of Palestinian women, for example. And we do not leave the way for lack of participation. We think that we know, because we are dealing with the cases of women victims of violence, and we know what are their priorities, and therefore we think that we can take the lead in proposing legislation and policies that are just and could meet the main needs and priorities of women in our society.
Thank you, Randa. Nada, anything to add?
Yes, so adding to what Randa said, which is brilliant, thank you. The fact that you have to have a law, or the fact that to live or to get send the message to the community saying that there is a law, and this action is criminalized by the state itself, it will give more power to the fact that when we say that this is violence and it's gender-based violence, it will give more weight and it will give it more attention within the community itself. I understand that the state itself is patriarchal by default so far. It is, however, based on the needs of women, based on the cases we've seen, based on the problem, due to the lack or due to the absence of a law that combats violence against women in all its forms, we've seen how this has affected women's access and justice. When anal rape is described as an indecent violation, this means women cannot access justice, and still doesn't have. This is, by the way, this is how the Egyptian law identifies or recognizes anal rape. It doesn't recognize anal rape. It's an indecent violation. So with this example specifically, women and men who are subjected to such crime, they are not accessing proper violence, and the perpetrators themselves, they will live in this culture of impunity as long as they are getting minimum punishment or getting minimum understanding of the crime they are committing. And that's what, this is the importance of this law. The law does not, by the way, when we call for a law to combat violence, we also ask for criminalizing violence from within the family members. So that means fathers who are violent against their sons and daughters, brothers, sisters, those people who usually the law would actually justify their violence against their family members, that will make a change in the law itself or the mindset of the community. It's one step that needs to be pushed, needs to be implemented in a way that protects all vulnerable groups, especially women and girls.
Thank you so much, Nada. Thank you all for covering these points so perfectly. I have another question from CTDC, but because we've already 2 minutes past, I promised CTDC that I'll put this question as a comment to our Facebook post, and I will invite Randa to answer it in writing if that's okay. It's on settler colonialism, and it's on the use of term militarization versus securitization. I just want to conclude by thanking you all very, very much for your time, for your generosity, and for giving us all these deep analysis to think of. The report is available online on WILPF's website, and we invite you all to share with us your thoughts on it and help us work together to take it forward. Massive thank you to our panelists for all the great work that they do, and also for their time today, as well to our interpreters, illustrators, and to the MENA and communication team, and all the colleagues at WILPF who have helped making this happen. And as I mentioned, the event is available on our website, and a link to the recording on YouTube will be available soon. Thank you all so much for your time, and we hope to continue this discussion in all the ways available. Thank you.
Thank you.
Thank you.
You're welcome. And I will answer the question in writing.
Thank you, Randa. I'm going to tag you to it in a minute.
Thank you very much.